We can actually work on the fractional CO2 laser.
Okay.
It's ablative lasers. It will make small, tiny ablative marks on the skin,
Okay.
but it will help to smoothen out the surface. And it will also be stimulating collagen.
Hi everyone, my name is Bernard. So it has been 1 month since I did my acne scarring treatment with Dr. Tham. So he did the subcision method, which is basically breaking the scars below my skin itself. So during the treatment itself, I didn't feel any discomfort because of the numbing cream and also of a bit of the anesthesia. It looks a bit scary, but actually I didn't feel any pain. So after the treatment, I was advised not to drink alcohol for about 7 days, and also to avoid doing strenuous activities as well as to avoid the sun. So a few days after the treatment, I can see some yellow color bruising, blue blacks on my face. So the bruises went off after about 2 weeks. Now after the treatment, I feel that my scars have lightened up quite a bit. Although it's not perfect yet, but I can certainly see that there's a huge change and improvement in the scars itself. It looks a bit smoother now, and it's not as indented and dark. So we are going to look for Dr. Elias for the second review, and I'm looking forward to what he says.
Was it very bad bruise?
Not really, a bit of yellow color.
So it does happen. Some people get a bit of bruising, but usually will slowly recover. But how is the scar?
So I personally can feel that it's lighter now, and then less dented also. Especially in the morning, I can see the difference.
And actually you can see it. You can see that from here, all the more depressed scar is actually nicely improved.
Yes.
The depression on the side actually becomes less depressed on the side.
Yes.
From this you can see. From the front, it actually become less obvious. So now that we have done the deeper layer, we can try and see how we can improve the surface a little bit. We can actually work on the fractional CO2 laser.
Okay.
It's ablative lasers. It will make small, tiny ablative marks on the skin,
Okay.
but it will help to smoothen out the surface. And it will also be stimulating collagen, but more superficially, not as deep as what we did, because we were trying to remove the deep scar the last round with the subcision and the profilo. What is important after fractional CO2 is that the skin will form some scabbing. It's important you maintain hydration so that it will heal well. Skin heal well in a moist environment, and you must avoid the sun as well. Make sure you don't go to the sun. Otherwise, you may get what they call post-inflammatory hyperpigmentation, PIH for short. So you become a dark patch, where instead of the scar getting better, the scar will get better, but you'll get a dark patch over the scar. And then it takes sometimes up to 6 weeks to recover. So hopefully you don't develop that. So that is a risk of the fractional CO2. Of course, you must make sure it's kept clean. There will be some antiseptic cream that you should apply to prevent infection of the wound. And if it is very dry, you can also spray this Mystic toner. And the Mystic toner contains not only just mineral water, so it also contains hyaluronic acid and antioxidant. So they will maintain hydration and reduce inflammation at the same time. Hello, I'm Dr. Elias Tham, and if you have an acne problem, it is important that you visit the doctor because there is different treatment strategy for different acne and acne scar conditions.